Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Ariq Irfan. I'm from Emap 9, a medical student from Unisala University. For today, I'm doing assessment number 3 from my Emap class. Let's get started. So for the first one, from the concert checklist, 1A of title an abstract identification as randomized trial in the title. So that is different intensities of aerobic training for patients with type 2 diabetes mellitus and knee osteoarthritis, randomized trial, randomized control trial. And then um, for the structure summary, trial design, methods, result, and conclusion. That is from objective. The purpose of this study was comparative intensities of aerobic for patient with knee osteoarthritis or KOA and type 2 diabetes mellitus in terms of glycemic control, pain relief, and functional outcome. Methods of a randomized label polylogical multi-center clinical trial concluded at two hospitals with Shanghai and Shenzhen and included 228 patients with type 2 diabetes, uh, T2DM, and KOR. And the result is of 228 patients. There's 212, 93% of the 228 patients completed the trial. The mean adjusted sex, baseline BMA, and baseline outcome measures, and HbA1c level at the 9-month follow-up decreased significantly in the high incentive training group compared with other groups. Yeah, and then the conclusion in KOA and 2DDM patients think high intensity stationary cycling can significantly improve glycemic control compared with moderate intensity and regular rehabilitation programs. Okay, that's for the abstract and an introduction for 2A. The first one is 2A. It says multimorbidity is a rising public health challenge with important implication for health management and policy. The most common multimorbidity pattern is the combination of cardiometabolic and osteoarticular disease, exemplified by the highly prevalent co-occurrence of type 2 diabetes and arthritis. The relationship between T2DM and knee osteoarthritis has garnered attention due to the overlapping prevalence and shared risk factors such as obesity and advanced aging, which has indicated a significant association between 2DM and KRA, a study that includes population with type 1DM and type 2DM observed a notably higher association of KRA and type 2DM with an odds ratio suggesting more than double the likelihood of individual and with type 2DM developing KRA compared with those two type 2DM. Interestingly, this associated with stronger among non-obese individuals highlighted the potential effect of diabetes beyond effect of obesity alone. Our studies that collective and core distinguish correction between diabetes, suggesting the mechanism linking between condition beyond factors like obesity. Um, and then the type 2B subject specific objective hypothesis is the purpose of this study was to compare different intensities of aerobic exercise for patients with CARA and T type 2 diabetes mellitus in term of glycemic control, pain relief, and functional outcome. And for the methods, trial design is 3A. This program is open label multi-center clinical trial. Eligible participants were recruited for Shanghai 6 people hospital related to Chiao University School of Medicine, the hospital related to Jeju University of Traditional Chinese Medicine, and Fuzhou Second General Hospital, and were divided into the intervention group and the control group. Then um, for the for A, for B is okay. Well, was confirmed according to the criteria from the National Institute for Health and Clinical Excellence. Patient can be diagnosed with COL if they are 45 years old. They have movement-related joint pains and either no morning knee stiffness or stiffness of 30 minutes or less. And then for number 5, intervention. The intervention is the the participants in the intervention group were instructed to undertake the regular rehabilitation plus stationary cycling exercise every day for at least 30 minutes at different targeted heart rates. And for outcomes, the primary outcome was a proposed change of HbA1c. The secondary outcome was change in the knee injury and osteoarthritis outcome score, or KOOS, from the baseline. Sample size is we aim to detect a difference of 0.5% in the HbA1c change from baseline to achieve an 80% power at significant level of 0.05 and consider 10% dropout rate. Approximately 70 participants were required per arm. And here's the data. And then for the randomized session, the participants were randomly assigned to the intervention and control group in a 1 by 1 ratio. The randomization sequence was generated by the institutional staff and was concealed from the PTs during follow-up. From blinding, no blinding was performed at trial. Only the analyst who assessed the outcome was blind to this trial. And then statistics analysis, there was conducted according to the intervention to treat the principle with multiple include data from participants with missing data under assumption that data were randomly missing. Then the result, based from the result, baseline characters from the study wasn't only of the 234 participants who underwent screening in the study. 228 were enrolled into the final analysis and randomized. Of these, 77 were in the intensive endurance and moderate intensive group. 76 were in the threshold training or high intensity group, and 75 were in control group. Of these, 212 of the 93% were completed the follow-up visits. Change in the AB1A1C, proposed change AB1 at the 6-month follow-up in each group. Change equals multivariate generalized linear model defined whose improvement as a dependent variable and the control group as the reference. And for the results, there's the results, BMI, and then discussion. Our randomized control trial involving type 2 diabetes, diabetes mellitus. A patient indicates that stationary cycling improved the physical function of KOA by improving muscle strength compared with the regular rehabilitation program, although participants in the high intensity stationary cycling had better functional result than participants in the control group. Participants in different intensities of stationary cycling had similar result with regard to pain relief and functional improvement. We also found that high intensity stationary cycling was more effective in glycemic control and moderate intensity stationary cycling. Then this study has several limitations. First, the result may be more generalized to individuals who are compatible with the study sample. The majority whom were men, obese, and had more than a high school education. Second, submaximal anchors has been used to define the domains of exercise, even though the majority of the methods have not been confirmed to elicit the domain-specific utility response. Third, a trial with a larger sample and size, long-term follow-up period to evaluate the effectiveness of exercise therapy in cardiac and type 2 diabetes mellitus patient. And the conclusion is among the Co-A and T type 2 diabetes mellitus patient, high-intensity stationary cycling has significantly greater glycemic control capability than moderate intensity stationary cycling and a regular rehabilitation program. However, high-intensity stationary cycling does not have a superior effect on pain relief and functional improvement in KOA compared with moderate intensity stationary cycling and regular rehabilitation program. The data advanced availability, the writer is coming in the article will be available in other ethics statement, author contribution, registration, funding, publisher note, conflict of interest, and yep. So for we have and then here, wait, protocol funding that was protocol only the protocol that is not um the rest are there. Only the protocol that is not. Yep. That is all from me. Sorry if there's a bit of misspelling or anything that is wrong. I will close the video. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.